Hello, hi. I'm being joined by SahiraMoon. we need to talk. Let's talk. Today we are having a talk on mental health. So excited about doing this because we are both very strong advocates for mental health and making sure people are educated, well informed, and that everyone is getting the help that they need and deserve. So we're going to be talking a lot about our own experiences as well. So first and foremost thing that I want to say is this is meant to be educational. This is meant to be, it is very personalized to us. So this is not going to be like a substitute for any guidance you could be getting from a medical professional. But we are here to answer any questions that you guys have. So you can feel free to put those in chat.
Hi, my name is SahiraMoon.
We are going to be also like keeping our VODs active, and then I'm going to be editing this for YouTube as well. So it's definitely going to be available for you guys to watch, especially if, say, you're watching it right now on YouTube, you know, that's where you're watching it right now and you hadn't had a chance to see it live, you know, that's totally fine. We love that. We want to make sure we're sharing the information everywhere we can. So basically how we're going to start things off, like I said, this is going to be based on like Moon and I's experience with our own mental health, as well as just experience and education and background that we have in kind of knowing a little bit more about the mental health field. So first off, I just want us to do like some basic introductions. It can include as well, just like I said, educational background that we have too, as much as you want to share, Moon. I'm going to pull my outline up so that y'all know I got ADHD and my brain will get sidetracked. I got to have my stuff ready to go.
You're so real for that. I totally got it.
Yeah. All right. So first off, like I said, my name is Maureen. For anyone who doesn't already know me, I am currently diagnosed with depression, anxiety, ADHD, and then I'm also kind of getting evaluated for PTSD, and I'm in therapy right now and getting treatment for PTSD. I don't know if it's like officially on my like diagnosis list or anything, but it's basically that's kind of everything right there. As far as different like educational experience that I have, I do have a minor in psychology, and I do have a degree, a master's degree in foundations and behavior analysis, and so I've got a little bit of that background as well. I'm very, very familiar with the mental health field as it pertains to ABA therapy and autistic kiddos. And then I'm also very familiar with the types of therapy that I've had before. So I'm going to be speaking on that a lot today.
Hi. As far as my background goes in psychology, I have a bachelor's degree in psychology. I graduated with a bachelor's in I think 2024. And I'm currently pursuing a master's degree in psychology as well. My program is very much a research-oriented program, so I at least as far as like the work in my lab goes and what I'm doing for my thesis as well, I'll be working more towards the experimental psychology side of things. The clinical side of psychology is also it was an option for me, but I chose to stick with my interests and go towards the experimental route. So that'll be more like social psychology, developmental psychology, things of that nature. I first sort of was, I guess, thrown into the ropes of thinking about mental health at a very, very, I guess, like young age. And I've sort of let those experiences shape how I go about life and how I, just kind of experience life as is, and it's very powerful, and it's very, it can be your best friend, but also your worst enemy. I'll say that's what I'll say about that.
That's good. That's a good way to put that. I love that. I love that. So the first thing that I kind of want us to talk about, and like I said, anyone in chat, if you guys want to share your experience or you want to ask questions, you're free to do that at any time, and we will look at it as we go. And we appreciate any input you guys have. But the first thing that I wanted to talk about is just kind of mental health in a general sense. I think that as a society, especially like here in the US, we have gotten a little bit more accepting of mental health struggles and diagnoses, but I do think that we still got a long way to go.
Sorry.
No, you're fine. That we still have got a long way to go for that. So we're going to be speaking on that a little bit too within our educational perspective and our own experiences too. But the first thing that I think that I want to address here is that everybody knows what TikTok is, right? We're all very familiar with that new fun app. I say new; it's not new anymore, but the app we got
New, like, I don't know,
videos.
7 years ago.
I know, right? New 7 years ago for me. It was like yesterday. I have no sense of time. So,
Mhm. No,
um,
it was new for me, and then it became old very quickly,
there
in my
you go. There
opinion.
you go, right? And then it's gonna be deleted, and then it wasn't deleted, and we still have it in the US, but we have it forever. That whole debate, right, goes back and forth. So in addition to
Messy.
TikTok, I love it.
Messy behavior.
Messy. So in addition to TikTok, of course, we've got like Instagram, we've got Facebook. I don't really use Facebook anymore, but we do have that as a social media outlet there. But TikTok is the big one. So I don't know about you guys, but I know recently my algorithm has gone into the mental health side, and there's a lot of stuff out there on that. And when you're able to just scroll through, I don't know how many videos per minute, you're getting a lot of information very quickly, and a lot of that information nowadays can also be regarding mental health, and it can be regarding diagnoses, symptoms. It could be regarding like, hey, did you know if you have ADHD, you may think like this, or you may think this, you may have this, type of symptom or experience, right? There's a lot of that out there. And so I think it's important that we kind of start with talking about when all of this information is out there, what information can you look at and think, okay, maybe I need to look into this a little more versus what you're hearing that is just completely fabricated and not true, right? And that's always hard to tell sometimes when you're on the internet and social media. So the first
Mhm.
thing that I really wanted us to talk about is just some misconceptions within the mental health field, and this can be general misconceptions or it can be very specific misconceptions. And so the first one that I want to talk about is the very general misconception that everybody has issues with mental health. Everybody struggles. Everybody's stressed. It's not a new thing that we need to be concerned about because it happens to everybody, right? And so I want to talk a little bit about that misconception. And I know, Moon, you and I had talked about how even thinking like that, as far as like, well, everybody has this nowadays, or everybody has ADHD nowadays, how that can actually be really harmful. So I don't know if you kind of wanted to get us started with that.
Yeah, I absolutely can. So I think part of the as far as like misconceptions goes, and like the idea that everybody now has like some form of like mental disorder or neurodivergency or things of like, things of that nature, it for one, I feel like it definitely devalues the like official diagnosis that a person receives, because if a person goes through all the steps of like assessing that they have a problem, going into a like getting treatment for it or getting diagnosed for it officially by a medical professional, and they have all these steps laid out for them, and they're validated in those steps along the way. Then they go out into the world and they incorporate that as part of their self-concept, and saying that they identify as this, or they identify as somebody who has, for example, like ADHD or depression or anxiety, or what's another like really common one, like OCD. That's
Mm-hmm.
things like that. People who are officially diagnosed with those things, they tend to get very, very devalued by people who kind of just throw it to the side, or they're like, oh, everybody has that these days, everybody has depression, everybody has anxiety.
Mm-hmm.
But it's really important to really, and this is like my psych research talking, it's really important to like operationally define these these disorders, especially within the context of what is happening to you.
Mm-hmm.
So, um, that for one is very, very important to sort of destigmatize what exactly is, like what is being perceived in the world. Um, and I think part of that goes into like, I think, I don't know if this was another point that I wanted to bring up, but there's also just a very like widespread lack of education on all
Mm-hmm.
of this.
Absolutely.
You know what I mean? And while there's a multitude of resources that people have put out there, but it's not in a form of like um I guess it's not palatable, let's say that.
Mm-hmm.
The resources that are out there aren't like super palatable for the general public. And
Mm-hmm.
even if I like it's really difficult um to educate people when sometimes they just aren't ready. You know what I
Mm-hmm.
mean? Like
Yeah,
there's definitely like
absolutely.
there's definitely barriers um to being able to educate people or to being able to try to inform people of something that that many people go through when they're simply not ready to be educated on that matter.
Yeah.
Um and I guess this might tailor away, but we could also talk about like how we navigate that, how we like can quote unquote make people ready.
Mm-hmm.
You know what I mean? Because
Yeah.
people don't like hearing the hard truth, and
Oh yeah.
sometimes the hard truth is something that they've ingrained into their brain for quite some time, and change is very difficult, as both you and I know.
Yeah. I think a couple things that you brought up as far as we're not very educated on it just day to day, right?
Mm-hmm.
It can be something that's hard to take because people may not be ready to hear it, right? So me personally, that kind of leads me to think of like cultural mindsets as well. So like where I grew up, um, and even like my background as someone who's Hispanic, right, and Latina, as I you like to
Mm-hmm.
point out, that is like how I grew up, you know, with my Hispanic family. That is what I know of my culture. But in addition to that, in the perspective of mental health, I also grew up in a very small area where mental health diagnoses almost don't exist. We don't really know
Mm-hmm.
things about them. We have family members that, oh, that's just our quirky cousin so and so, right? But that's kind of all that's said, right? And so I think that it's important to also talk about that, especially if you come from that perspective, because
Absolutely.
you could
Yeah.
be struggling and you're being made to believe that your struggles are normal and you need to buck it up and grow up. You could be struggling and think that you are completely alone and you don't know why you struggle so much, and that can almost be internalized into like self-loathing and self-hatred, which ding ding ding, let's talk about that on my end and my experience. That is a lot of what I've dealt with in my experience. So um, growing up where I did, and then let's just talk about culture as well. We didn't talk about mental health really at all. We didn't talk about even just the need for like handling stress, you know, or having ways to relax and de-stress. And then where I grew up, I know a lot of people used things like, you know, alcohol to de-stress at the end of the day. Oh, get home and have that beer, you know, get home and let's do this, go out on the weekends and go drink. And then that was a way to de-stress. And so, which isn't always the healthiest way to do so. Um, and so I think a lot of what you mentioned, I was just like, oh my gosh, yeah, let's talk about that a little bit. So after having grown up in an area where these things were not talked about, I then went off to school in a very, very diverse city, Houston. Completely big, huge, diverse, very like so many moving parts, right? Not only was it a shock to me growing up where I did, but it was also like I'm hearing about things like depression. And, it just really wasn't talked about where I grew up. And then when I get to college and I'm, what, I think 21, 22, it just takes a screener to realize that I need to be looking into the fact that I'm depressed. And like I had no idea. I was like, well, I'm just sad, I'm just this. I'm just dealing with college life. So luckily on most college campuses, when you go to their health center, they will have like depression screenings. Or they have some type of screening because they know to be looking out for that in especially in young 20s. And so that kind of led me to, I just answered these questions honestly, and they're like, hey, like you scored on like the severe end here. Like, we really recommend you talk to somebody, and it was just that, it was that easy. Um, and so I think that knowing your perspectives and when it's something that is introduced to you, like really being able to hear it and really being open to hearing about it, just like you said, getting people ready to like to learn and educate, right? And so I didn't
Hmm.
know, with that being said, if you wanted to talk a little bit on like your like cultural background and how mental health might be looked at in that perspective, or if you had any struggles with like changing your perspective on it at all, like especially, as you're getting into
Absolutely.
school.
Yeah, absolutely. I can totally touch on them. So, so obviously I identify as a queer Pakistani American, right? That's like just a few assets or a few facets of my identity, which just so happens to be what I'm doing my research in. Um, but um, yeah, as far as like my culture goes, and I just talked about this in one of my classes. One of the articles that I read what touched on resilience factors in developmental psychology, especially in psychopathology. Um, and um, talking about resilience and connecting that to culture, when in my culture especially, and I think many brown individuals can relate to this, but it's very like male centralized. And what I mean by that is um, when when you think of a typical like, or I guess when I think of a typical brown family, I should say that when I think of a brown family, I think of, the man as like that is the main person. So as far as like my culture goes, um I was saying that, and I think that everybody can, or like any brown individual can relate to this. But when you think of particular like families, like brown families, or sorry, when I think of particular brown families, I typically think of like the man being at like the quote unquote center of the house and being like the
Mm-hmm.
moneymaker and this, that, and the third. And I know that society now has definitely progressed past that.
Mm-hmm.
We've decentralized the patriarch.
Mm-hmm.
We now believe in incorporating women and actually affirming gender equality.
Mm-hmm.
And we hold that as a very, very important part of everything that we do, which is really, really amazing and beautiful. And while there is still work to do on incorporating more than just the binary of men and women, um, I still think that we're taking steps in the right direction, and I see that as well in like being a Muslim as well. There that will be like a separate thing that I'll talk about later. But
Mm-hmm.
um, as far as culture goes, the idea of like the patriarch and like having a man be at the forefront or whatever, that was definitely like um that was definitely really, really ingrained into like how I grew up.
Mm-hmm.
Um, Whenever I would feel some kind of way about something, or whenever I would have like a problem, or just really emotional about like really anything, I would always be like my emotions would very much be like invalidated, or they would just
Mm-hmm.
be like, you're a man, get over it, like,
Mm-hmm.
you have work to do, sort of thing. And so that kind of like that that reinforcement of like, don't think about your emotions, suppress them, like don't let them conceal, don't feel, to quote Elsa,
Okay, okay.
right?
I was gonna say, okay,
Um,
Elsa.
that's like, I mean, like that's just like that's like one of the
Mm-hmm.
most prominent examples of like, if you're feeling something, you can only suppress it for so long
Mm-hmm.
before it all goes to shit. You know what I
Mm-hmm.
mean?
Yeah, absolutely.
Before you just like have a complete breakdown and all of that. And it's really like, I would say it's very, um I guess, character building in a sense,
Mm-hmm.
to like have that resilience, especially when you're in a space that reinforces the idea of like not being able to talk about it because it's so taboo and it's so
Mm-hmm.
stigmatized.
Yep.
And every especially, and like, there's an entire other like, um perspective that I feel like we don't really consider enough as well. Thinking about, like, my parents, for example, right? My parents, um emigrated from Pakistan to here in America, and that entire experience for them must have been so like immensely traumatic. And
Mm-hmm.
I was reminded of this very recently whenever I was having a time. But like, I just have to consider their perspective as well. They're just doing what they can. You
Mm-hmm.
know what I mean? And I recognize that, and it really it helps me to, um sort of think about like my culture and think about how I was raised in the context of like my parents' culture and like what they were able to provide me,
Mm-hmm.
um given that.
Yeah.
And it builds character, but it also, like, touching on resilience again, it builds it kind of like it reinforces that resilience factor of like, you know it can either, I can either continue that sort of destructive thinking of like, don't put your shit to the side, whatever,
Mm-hmm.
or I can change that, and I
Mm-hmm.
can I can say, you're stronger than this. Like, whatever these feelings are, you're stronger than this. You could, like, just kind of like, giving myself affirmations.
Mm-hmm.
And that's something that I've learned over time. Um, Whenever I first, started to kind of, like, experience these emotions on a much more heavier level, I was definitely more on like the negative side of things, where I would like, it would always just be like me tearing myself down, sort of thing.
Mm-hmm.
And while that is awful, it's, sometimes, like, whenever you're in a space, like I said, like whenever you're in a space that reinforces not talking about your feelings, you it starts to feel like you don't really have a choice in the matter.
Mm-hmm.
But changing your space and changing how you, like, just changing pretty much everything can, be very difficult, but it also can be very relieving and very freeing.
Mm-hmm.
And I think it's really important to think about.
Yeah, absolutely. I think you spoke on a lot of really, really awesome things. So one of the things being like, I think the ways that we grew up and the ways that we coped at the time, um, thinking about like trauma, even whether it was like your parents, your own trauma, my own trauma, that sometimes these like mental health, I don't even like saying the word disorders, but just referring to that's how they're referred to, um, some of these things can stem from some type of trauma in your life, and some of them don't stem that way. Like ADHD is just something that you just have, but there are other things that can come from some of this trauma. And so I think that in being someone that has grown up that way, potentially, not having resources like that, not having, TikTok. I know now it's like at least young people have some of these other ways that information is kind of disseminated to them. Um, just really being open to hearing and learning about mental health from a different perspective, but then also if you've been someone that helped perpetuate an environment like that, that you also are open to hearing what people have to say about their own experiences in mental health. So I think there's like two sides of the coin there. But with all that being said, and it was kind of talking on the way we grew up, we're not saying that like things like TikTok that they're negative, because I actually in my experience have had some of the information that I've gotten from TikTok be very positive for me. And so I think that what we wanted to emphasize about like, you know, TikTok, going on Google and looking things up versus like facts is that we think it's really good to be looking into the sources that you have for these things, but just remembering like to take things with a grain of salt and to then use that to maybe then talk to someone like a medical professional or mental health specialist to then kind of get at the root of any concerns that you might have about yourself or somebody in your life if you're kind of you know thinking about helping someone get help, right?
Mhm.
So that's kind of where we wanted to go with that. And then the other thing that we wanted to talk about in the vein of not devaluing mental health diagnoses for people that do have them versus like, oh, this happens to me, so I think I have this, right? It's important to note that for some mental health diagnoses, a lot of the core symptoms are just like typical things, but at an elevated level. So sometimes it may seem like, okay, well, everybody does that. But when we're talking about the actual diagnosis, it may be that some of these typical things are just extremely elevated to the point where they are hard to manage and they are hard to deal with, and it is hard to live their life, right? So we wanted to kind of emphasize that too. And then I had put this in here, but then Moon had brought up a good point that again, we don't want you guys to then go do your own research where you're looking into like every symptom and everything about mental health diagnoses, or it might be like, oh my gosh, I have this and I have this and I have this, right? Nothing like that. But just to kind of come from an educational perspective that when we are talking about mental health diagnoses, they do come from a specific thing called the DSM-5. So if you've ever heard that being talked about, that's that Diagnostic and Statistical Manual of Mental Health Disorders, and we're currently in the fifth edition, which is where the five comes from. And so every mental health diagnosis has its own very objective list of like symptoms and things like that that are then evaluated by mental health professionals or medical specialists, anything like that. So just to kind of have you guys be aware of that, because sometimes when you're looking at like TikTok or other references, they're like, oh, people with ADHD do this, and oh, autistic people do this, and that may not always be the case. For example, like I can speak on this. My experience with working with autistic kids, like you have the things out there in media, like you know, the Good Doctor, I think was one. Um, that is a very niche, not even niche, very straight sided one way to look at like autism, right? And that's not always going to be the case because autism is a spectrum, you know, and so every autistic person is different. And so also
Mhm.
just being aware of if you've got this viewpoint of that's what that's like, that may not actually be the case. That's like one side or one perspective maybe that you've seen, you know. And so just keeping that in mind when you're getting some of those things like here this symptom and people with ADHD do this and that's very common with people with ADHD, you know, things like that. Just really being able to take that with a grain of salt and kind of doing like your own research and talking to someone who can help you kind of discern that information. I don't know if you wanted to add anything to that.
I mean, you kind of hit it. You hit the nail on the head with it. I want to say, I think, talking about like, I guess psych talk, if you will, right?
Mm-hmm.
Um, People who, and this goes for any sort of short form like content, and I think we talked about this a little bit beforehand, but um, people who want to like I guess sort of get a point across or try to highlight something that might be super important on like a facet of like mental health, or like talking about a specific diagnosis like ADHD or depression or things of
Mm-hmm.
that nature. They're going to want to push the more important stuff, like the very like um you know they're not going to want to push like the nitty gritty, because then it gets too
Mm-hmm.
complicated,
Yeah.
and it kind of brings back a point that I brought earlier of if the information that people put out there doesn't it starts to become less palatable for the general
Mm-hmm.
public.
Mm-hmm.
So whenever people make TikToks, or when people make any sort of short form content for the media to consume, um, it kind of they push like the more important information, and in that it starts to like if that gets popular, right, then you know you have like the TikTok algorithm, and that pushes that short form content, and people interact with it, and they're like, oh my god, I do see this, I do relate to this, and this, that, and the third. um it's sort of that in and of itself, or like it inherently um goes into an indirect process of like devaluing the diagnosis itself too, you know
Mm-hmm.
what I mean?
Mm-hmm. Yeah.
And while the information in a more generalized form is important, it's also important for you to have like, like I guess like internet literacy.
Mm-hmm.
um
Mm-hmm.
so, and what I mean by that is taking the information that you hear on the internet with a grain of salt until you are able to seek a professional, because the professional is at the end of the day going to be the one who can help you further with it.
Mm-hmm.
And while, again, like I said, TikTok is super great at like pushing all of the like the highlights of each of the things that they talk about. But as far as the nitty gritty goes, that's when people start to get confused, and that's when things like screenings come in, or assessments or self report scales, and all of those things,
Mm-hmm.
to get assessed for a specific diagnosis. That's when all of those things come into play, and that, again, seeking professional help, that's when those things start to, you know, make themselves known. And that's where you're able to, um, I guess, get a diagnosis.
Yeah, absolutely. So from there, I think we're gonna kind of talk on our own processes with, like, I think getting diagnosed and getting and seeking treatment. But I did want to say, because I think that we've kind of talked about, more along the lines of like being cautious with self-diagnosis. But I think even in looking in terms of like, I went to school and I did a screening, and that's when someone was like, hey, you might want to look into like getting some help for depression. um there there is some benefit to like just recognizing that you're struggling and not even really know what maybe you're struggling with, just going like, I'm struggling, like day-to-day life is getting very difficult for me to do, and then being like, so I think I need to talk to somebody about that, and kind of starting maybe even just with your primary care physician and going from there, and then from there to inform treatment, they might want to evaluate, you for diagnoses. It's not always just going to be like, hey, let me talk to someone about the fact that I think I'm depressed, or let me talk to someone about the fact that I think I might have ADHD. Sometimes it's just something is wrong and I don't know what it is, but I know that I need help, and that's okay too. That's absolutely okay too.
Mm-hmm.
So I just want to
For
touch on that
sure.
too, because I think when I it originally like thought about us talking about it, I was looking very much in the line of like self-diagnosing, but there's so many other different ways that you can get help within the mental health field. Even if it's just like you're struggling with something that
Mm.
you don't know what's happening,
Yeah,
right? Yeah.
absolutely. Yeah.
So I'm gonna go ahead and kind of talk on my experiences. I know I said I threw quite a few diagnoses out there as far as like what I'm diagnosed with right now. Just talking about my experience and like with each one and the frame of thought I had at the time, and kind of what led me to now being more open to the fact that I might even have more diagnoses that I don't know about yet. And then that's okay. But just talking about like where I grew up, how my family was, I did have a teacher um, when I was in first grade tell my mom that she thought that I needed to get assessed for ADHD. And my mom, love her to death. I think she's a great woman. She's told me this story before where she was like, I just think she didn't like you. And I told her, like, no, you don't have ADHD, like, this and that. Like, that was her immediate response. It wasn't like, oh, she's concerned, let me go ahead and just go through with doing that because, like, it's been noticed, right? So she just said that, and then that was that, right? And so she would tell me that story. And I'd always like, oh, yeah, I don't have ADHD. Lo and behold, here I am at 34. I got diagnosed when I was 33. So I had that type of thing happened growing up. And then like coming into adulthood and even now, like getting to a point where I was struggling so much with the symptoms of ADHD that it did affect my job. You know, it does affect my current ability to be employed. Um, it, I knew I was struggling, but I very much thought that it was like struggles that I just needed to deal with, right? Struggles that I just needed to get through the day and deal with. And so I think that the good thing in my experience is that that screening that I had in college for depression opened the door for like so much in the mental health world for me. So I did struggle with depression in my early 20s, 6 months, maybe a year. Like it was a very minor episode. Um, then come into I end up in my late 20s in an abusive relationship. I'm struggling with my depression every day. I am now struggling with PTSD from that, type stuff. And then hitting about a year ago when finally like burnout, depression, potentially from having to try to deal with the symptoms of ADHD for so long and not knowing that that's what was going on. My depression got very, very bad to the point where I would not be able to get up out of bed. Um, I would not be able to like shower. I wouldn't be able to take care of myself, brush my teeth, Um, because I think whenever people again talk about depression, and it's like, oh, you're sad, just go do this and you'll be fine. Just go for a walk and you'll be fine, right? There's so many other things when it comes to depression that someone could be struggling with that they're not going to tell anybody. They're not going to say it because it's embarrassing. Like to me, it was embarrassing. I didn't want to tell people that I was struggling with brushing my teeth, that I was struggling with showering, that I couldn't get out of bed, like that and so, and then when I tried to talk about those things, it was almost like, well, just get up, like, well, just do it. It's always like, just do it, right? And it's just not that simple when you're dealing with struggles like that every day. So I finally got to a point where I was like, I just want medication. So I had done therapy in my 20s when I had first heard like, hey, your depression screening was very severe, I had done therapy. Come to a point now where I knew that I wasn't ready for therapy. I didn't want to do therapy. I was just like, I need to fix myself, so put me on medication. Not the best perspective to have, I will say. But I know sometimes when people are seeking treatment, it's like, I need something that's going to help me be able to like live my life, get through my routine and all of that stuff. And so I very much was seeking like medication as treatment. And medication did help me a lot. Kettle's like, girl, same. Sometimes you just get to
Yeah.
that point because I was struggling with work. I was struggling with day to day feelings, interpersonal relationship. I was struggling with a lot. Couldn't get out of bed, couldn't brush my teeth, couldn't shower, right? So I was like, I need medication. And so I finally got to a psychiatrist who is an MD, is a doctor. They can diagnose, they can prescribe medication, and I got on antidepressants. That is then how I got to my ADHD diagnosis. And now like once the depression was finally treated in a way that was like it was being minimized by medication, then that's whenever like the perspective of, hey, I have other stuff going on and now I can actually like really tell, let's talk about that, and hey, yeah, you do have ADHD. And it's like, oh, okay. you know
Yeah,
so
definitely.
yeah, even just like dealing with things that like everyone talks about depression and anxiety, right? Everybody has depression and anxiety in some way, people say, but sometimes those are like indications sometimes that things are going on, some other things might be going on. So even just general getting help for your struggles, whatever they may be, can help lead you to just being better informed about yourself and better informed to be treated in relation to your mental health. Kettle said, I think that's why my last therapist ended up working when I was stable enough to. Yeah, that's really important too, and we'll talk about a little bit about that. Is that there's like different types of therapy, there's different types of medication management, and sometimes you might need both, and that's okay. I currently do both, so and then that's okay. So that's kind of I think how I'm dealing with with everything now and kind of where I've led to where I do have a couple diagnoses, but it has just really helped me understand myself more. It has helped me not feel so bad about things that I couldn't do because there was a reason that I couldn't do them. And it has helped me now be able to try to move forward knowing this about myself and like kind of restructuring my life, if I'm being honest, in like the best way possible. And then now I'm in therapy, and that therapy is specifically targeted to like these feelings that I have, which are usually like feelings of I'm not good enough, because of some of that I went through with struggling and not knowing why I was struggling, and then also with the PTSD. So, and I'm currently like in treatment for those things, and so I have a kind of full rounded, an all around experience right now with how I'm getting treatment. So that's my story, Moon. I don't know if you want to talk on your story at all.
Well, um,
Well, you know.
I can touch on it a little bit. You know, I will say though, I may or may not mention some things that might be like a little bit triggering. So just a trigger warning, like just in general. I will try to like minimize them as much as I can, just so that it's not like super awful,
Yeah.
I guess. But
Probably whenever
yeah.
you're
So
getting, if you think you're getting to a point where like, so you start kind of general and you're about to mention it, maybe just give an additional like, hey, trigger warning, and then go into it. I
yeah,
think that'll be really
yeah,
helpful.
yeah,
Yeah.
for sure. Um, so Well, for one, I know I probably should mention I have had therapy on my like to do list, I guess, for quite some time. It's been like I don't know, I want to say like 2 or 3 years that I've been like I want to get therapy, I want to get therapy, I want to get therapy, but there's always that but. And
Mm-hmm.
that's something that I'm personally working to try to defeat is like there's no buts. You need to like you
Mm-hmm.
need help, you know? And like I think acknowledging that is a very big step for me, at least in and of itself.
Mm-hmm.
And I'm really grateful that I'm able to sit here today and say that. But you know, my mental health struggles, I think um, I will say that I think they probably started from like a very like young age. Um, I think it was like I want to say as far as grade wise goes, I'm probably like maybe like the first like transit like the first like real sort of um kind of heavy transition from like fifth to sixth grade, going from elementary to middle school.
Mm-hmm.
I mean, in elementary school, I was bullied. We can say it. I was bullied for just I want to say like I mean I don't really think about it too much now, but like you know I was bullied for my weight. I was bullied for um just I guess I don't know, being weird. I guess I don't fucking know. It was just I think the main thing was just like weight. I was fat. I was overweight. And I still am. But I don't let that like it's like a yes and thing for me now at this point because it's just like okay, so what?
Move on.
now people are apparently now people are apparently glorifying obesity, and I'm just like, if you want to glorify me so bad, go to McDonald's, get that cheeseburger. Matter of fact, get the double or triple. Like you want to talk about glorifying obesity? Like, bitch, you ain't seen nothing. Anyway, um, so that like that. Back to the main point. um, so like the first like major I guess transition from fifth to sixth grade is kind of when I started to um sort of see that things were wrong and that there were issues um but I wasn't able to like pinpoint what those
Mm-hmm.
issues were, and I think that frustration, not being able to even voice it as well, really started to impact me, and to the point where um like this is kind of where the trigger warning part comes in,
Mm-hmm.
to the point where like in seventh grade I was very I'll say it, suicidal. um that's kind of like where I was in seventh grade, and that part of my life I tend to like suppress because I don't really that's like a part of my life where I'm just like that's such it's such a dark like
Mm-hmm.
it's just such a dark point of my life that I like I look back at it and I'm like wow, like you know I have grown so much as an individual and
Mm-hmm.
as a just a person living in the world. And if I were to tell anything to my younger self, it's that um you're valid in everything that you're doing. You're valid in your thoughts. And I'm sorry that other people aren't able to see that,
Mhm.
you know?
Yeah, absolutely.
I think that's one of the most important things to me, that I wish that somebody had told me when I was younger, is just like, I'm sorry.
Mhm.
I think like that's and like actually mean it, you know what I mean?
Yeah.
Like people would you would talk about like, saying like, I'm this, I'm that, but it's like
Preach.
it doesn't really hi Ray. Um it wouldn't really mean anything relevant unless they actually like sort of intook it and actually showed like empathy the way that I like to show empathy now to other people.
Yeah,
Um
absolutely.
but yeah, so like seventh grade, that's kind of like where it was. That's kind of like where my mental health struggles started.
Hmm.
And that from then on I kind of um I then sort of like adopted that mentality of like um incorporating my views into how I think, how I speak, how I interact with others, and sort of like making it my whole making it my whole personality, if that makes sense. And I think like part of that was like the very first time that I came out as queer, right? Like
Hmm.
the very first time that I came out as queer was um like to anybody like relevant
Hmm.
was probably like um I think I want to say like December of 2012.
Hmm.
I think that was like the very first time that I like actually voiced it to somebody and like actually sort of said something to
Hmm.
somebody about it. And like that in and of itself, like it was very emotional for one. What you're
Absolutely.
speaking about is part of the reason why we're friends. Oh,
Mm.
much love to you, Ray. Much love to you.
Love it.
Um, but yeah, like it's just I think like voicing that and like being able to be like validated in a time of vulnerability is so immensely important. And I think part of uh the and like going back to what I was talking about earlier, resilience, and I know Ray, like both of us were talking about this on Thursday.
Hmm.
um like resilience in in different cultural settings is very very different. Being able to have the support system that I had at that time, even if it was just a couple of people, like
Hmm.
they still validated me, and they still were like, it doesn't change anything about you, it doesn't change who you are, it doesn't change, like we're still friends with you. And I think that was what like really like stuck with me, and I'm really glad that it did. Because when I started to kind of incorporate that into my personality and incorporating that into my interactions and all of that, um I wasn't met with the same agreement and acceptance that I was met with in my support system. I was met with adversity, as is as is the case with most stigmatized identities. I think we can all
Yeah.
agree.
Yeah.
Um, so that adversity is kind of what like pushed me towards that sort of negative side of things. And that's when it got to a point where I was, again, trigger warning, it got to a point where I was like, just I'm not seeing a purpose anymore, you
Hmm.
know. And then something in me just kind of, I think it just something in me just clicked, and I was like, I need to like I can't prove these people right, you know what I mean?
Hmm.
Like I think that sort of the the clicking of like um like these people who are showing me this hate, showing me whatever, all of this, like I have to prove them wrong. I have to be better than that. And I think like repeatedly, and that's again, that's where the resilience thing comes in, is like being so resilient in like in the face of adversity is what pushed me past um all of the things that like the obstacles that were thrown at me when I was younger.
Hmm.
um So now I can stand today and I can be like, you know, I've lived through this experience. I've I've been in that hole, and it's very difficult to get out of, but you
Mhm.
absolutely can get out of it.
Oh, yeah.
And it's, I think that's also part of the reason why I'm such a huge empathizer as well, is because I never want to see anybody like in that struggle. And I
Hmm.
know how hard it is to like get out of there. And I just my like in when I empathize with people, I definitely am like I'm trying to sort of prevent them from going deeper before they do end up getting deeper. And
Yeah.
that's kind of, that's another thing that I will, like, I guess, touch on later. But um yeah, that's one thing. And then as far as diagnoses, right, I haven't really been officially like diagnosed with um uh like depression or anxiety or anything. I haven't really been like officially diagnosed with those, but I will say I did you know, I had a talk with my PCP a couple months ago, and I was like, what would a, you know, what would a screening or an assessment for ADHD look like?
Mhm.
Because I, you know, I noticed in myself and in my immediate surroundings as well that uh you know, they would always I would like display symptoms of ADHD to like it just to my friends or to like the just my surrounding like class or whatever the case was. And this one right here, or I guess in that corner,
Wherever
because
I
it's
am,
showing
what
up
on
like that on
whichever
your,
screen.
wherever you are. um she would always be the one whenever whenever we hung out. She would be like, "Do you have ADHD?" And this was after she got her diagnosis too. So I was like, I don't know. I never really I never thought about it. But like I, you know, there would be very clear signs and very clear like, you know, uh I guess like symptoms that I would display. And she was like, you should talk to, you should like try to like get assessed for that. And I was like, okay, maybe I'll give it some thought. And you know, part, I think like the reason why I guess it took so long is, again, part of the like part of how I grew up is like, you know, mental health is very stigmatized, and it's like something you don't talk about. And as much as we can say like it's important to talk about these things, it's important to do it, you're not going to be able to like actually talk about those things unless you really internalize that it's okay to talk about them.
Hmm.
Which is why partly like it took me so long to even think about like bringing that question up to my PCB. Because like, you know, every time I would go visit him, I would be like, oh, nothing's wrong, I'm okay, you know, just give me my checkup and let me get out of here, let me get out of your way, sort of thing. But you know, I think a couple of months ago I mustered up the courage to actually say the words like, what would a an assessment of ADHD look like? And he was like, yeah, I can pull that for you if you'd like. There's like a self-report questionnaire that we have people fill out. And if if we, you know, based off of the results of that, if we think that um they typically show signs of ADHD, then we'll take further action from there. But fill out this questionnaire and come back with it in a couple weeks. And he also gave me like a small, it was like a 2 week supply of a medication that I now am like on. But he gave me a 2 week supply, and he was like, "See how you feel on this." And I was like, "All right, cool." So I trial tested it, and I was like, "Oh, like I felt good. Like I felt like way more in control of things, and I felt like really, really um like up here um for like the first couple of days on it." And that feeling is so like that I had never felt that way, like so in control of everything the way I was in that moment, in like, I want to say like, I don't know, like 10 years. It was crazy. And so
Hmm.
I you know, I told, you know, I told this to my my PCP. I was like, hey, so like this is like I feel this feels like it's doing something, it's helping me. but I only felt it for like the first couple of days, and afterwards I was just like, it's not really doing anything much for me. And so that's when he started. He upped my dose, and he um, was, he gave me, he prescribed me medicine, and I was like, okay, that's sick, like that's amazing. Um, and I've been taking it for like about like a month or so consistently, and the amount of emotions that I felt within the past month have been so much more than the emotions that I have felt in the past 23 years of my life. And that's like something that I'm very, very proud to say, because, you know, again, this is like going back to like, younger me. Younger me wouldn't have even like fathomed the idea of like being able to express myself, let alone my emotions, or like
Yeah.
anything else. And so it's a really, really beautiful thing, and it's really healing, and um it's just amazing. Um but it again, this all ties back to taking that first step of like having the courage to voice it, you know.
Mhm. Yeah.
And yeah, that's kind of where I stand as far as like my diagnosis. So like I only have um a, a a diagnosis of ADHD, but that's from my PCP. um as far as like other diagnoses goes, I would have to go into like a psychiatrist appointment, or like another official that's outside of my PCP.
Mhm.
So I started therapy for the first time in 3 years this week.
That's
I'm so proud of you.
amazing. That's
So proud
so
of you.
amazing. I hope that that's been going well. Oh, or it's only this week. I think at first you're going to be like, okay, yeah, this is cool. And then as you start to get really into it, I hope that you find that it's a good experience for you and that it's a really helpful experience. I think that's so amazing that you've taken the step of like doing that, because I finally took the step to do that too. And it took me quite a while to actually be ready, and I think that that's really important too. And I was finally in an environment to be ready for that. And so I think when you are ready and you're willing and you're there, like, getting the help, it's just going to be really beneficial. So I love that for you. I love that for you. Love it.
Mm.
There
They
were
also said my therapist told me I was a good person, and I cried when he said that. Yeah.
yes,
It's because you
yes.
are.
And you are.
It's
Yeah.
because you are.
That's and it's crazy because I think the first therapist that I went to would say things that I just felt validated for having my feelings. And it's because
Yes.
like they're your feelings. Of course you should feel validated. Like you're experiencing them, And it took me a long time, I
Hmm.
think, to know that. Um and that like you're enough because you're you, like just things like that.
Yeah.
And I think
I couldn't say
too,
it better myself. Yeah, you're
yeah.
right.
There were some things that you said when you were talking, and I had a point, and I was like, "Oh," and then it went away because again, ADHD. And both of us were just
Real.
like, "Where was that train of thought going?" But I think it was
Hmm.
that. I think it was when we were talking about like ADHD, knowing symptoms, things like that. So when you hear, this is a kind of important thing for me too. When you hear ADHD, I think I have ADHD too. You get it.
Period.
When you hear the term ADHD, like I'm gonna say, like, oh, what do you think of? What is the most forefront thing in your head when someone's like ADHD, as far as like what you think ADHD is? Like, what did it used to be for you?
Um, I used to literally, yes. I was just about to say
Literally,
that.
right?
Like
Squirrel.
like the was it Doug from
Mm-hmm.
Up, right? The
Mm-hmm.
dog, like him going squirrel and like looking at the squirrel.
Yeah.
That, and then like
Not
but I
able
think
to.
I'm trying to channel the same energy
Yeah.
of
Okay,
like
got it. Kaleidoscope brain,
kaleidoscope
right? Oh
brain
man, I've
is
never heard that, and I
wild.
love that. So
I'm
the
thinking of like a kaleidoscope, and I'm like,
Like, yeah,
oh my
whoa, literally,
god.
whoa, look at all the
Yeah.
things,
Yeah,
yeah.
very
So,
that, yeah.
hmm so whenever I thought of ADHD, it was always that like that hyperactive. It was like I'm up, I can't sit down, I'm moving all around, I'm doing all this stuff, right? But that's not all
Mm-hmm.
that ADHD is, and I think that's important to note too. Is that, like you said, I think that we have ways in society that we're trying to say, hey, this is the basic understanding of this, just so that we're educating people, but that's not all that it is. And so I think something that you and I have both learned about ADHD is that sometimes it can make us like very highly emotional, and we do like get really upset, and we're really sensitive to rejection, you know. There's like other parts
Yes.
of ADHD that I had no I had no idea about.
Literally.
Like, you know, and so that's why it's important to like know what your diagnoses are, because it can explain other things about yourself that you were just like, why am I like this? You know, that was me. Because I think back to when I was a
Mhm.
kid, I was emotional, crying about anything all the time. Just like you said, you were trying to push your feelings down because you weren't allowed essentially to feel them. For me, it was like I got tired of people like basically I felt like I was a baby even as I was getting older, because people were like, why are you crying, why are you this, like why do you cry every time? It was like someone would get upset with me, an adult would yell at me like something. I just wanted to cry, and I would cry sometimes, so I
Mhm.
wasn't able to hold it in when I was younger. And then as I got older,
Mhm.
I started holding it in more, and I started trying to like push it down. So then I got to a point where in the last 5 years it was like impossible for me to cry when I was like,
Wow.
I need to cry, I feel sad right now. I couldn't cry, and it would always come out later at the worst possible times, right?
Yeah.
And that was
Absolutely.
just very bad. I did not like that. And so now I'm getting finally getting back in touch with like that girl who likes to cry a lot. And that's okay. It's okay to
That is
cry, you know?
okay. It's absolutely okay. It's
Yeah.
totally okay and valid
Yeah.
to cry.
Absolutely. I'm
Like
still figuring
it's
out what my ADHD means, but it's so person central. Got it. And so I think too, in talking about ADHD, attention deficit hyperactivity disorder, there are three different types of presentations of ADHD. There's like the hyperactive, the one I used to think of. There's the attention deficit where you're like, oh, scroll this, that. And then like there's a combined presentation, which it turns out I'm combined, you know? My sister has ADD. So actually now the term ADD is referred to under the umbrella term of ADHD. So when we talk about changes that have been made and we talk about that DSM-5 and how things are categorized, if your sister were to get diagnosed these days, she would get diagnosed with ADHD, because it's all under the same umbrella term now. And it's just three different presentations. So it's the hyperactive presentation, the attention deficit or inattentive presentation, and there's combined. And so I'm combined. So it's funny because I never thought of myself as combined, like the hyperactive, but then the more I thought about it, I'm always like, even now when you were talking, I was like picking at my skin, which is a big one that I do. I pick at my skin on my fingers. Something about my body is always moving. And like the other day, I was like, I'm gonna sit and literally not move any part of my body. It was almost painful. Like, it was so
oh my
bad.
goodness.
Yeah. Oh, yep. I'm a master's student studying educational psych. My bachelor's degree. There you go. And I knew that because I knew that. Yes, I knew this about. I think y'all. So yeah, it's like you're applying for PhD programs in social psychology. That is so amazing. I am hoping the best for you with that. That is amazing. You should be so proud of that. I could never a PhD. I was like, I don't think I can do it. I don't think I can do it. But that's awesome, girl.
Mhm.
So I am like, I cannot, I do have to be moving a lot. And so I have that. And then I've got processing takes a while. I can't maintain attention on some things. And so, yeah, I work in, work in process. I got you. I think that's when we talk about, like, it's important to know, like, what the symptoms are, what the core is of some of these diagnoses, because it's not okay to just, oh, everybody has that, you know, and to think you understand it, but then it turns out it's just going to help you better inform about yourself. Like the fact that emotional part of ADHD, I'm like, that's crazy. I understand myself now, like just knowing that, like why I feel really empathetic, why I get so emotional. And it's just because like the whole thing about ADHD is like we process and we do things differently. So thank you so much for the follow. I so appreciate you. My follows are anonymous, just in case you want to lurk, you know want to do all that. But I do see you. I appreciate you, and yeah, thank you. um, and so that's why I think educating yourself, but making sure you're educating yourself in a positive way, and that you're seeking help, as like Moon did, from like primary care physician, just someone that you can like, okay, let's get on the avenue of treatment, let's get on the avenue of diagnosis, right? It's really important to do that. Um, so kind of with everything that we've covered, so when you get to a point where you're like, I need help, or you get to a point where you're like, I think I might have this, I need to figure this out because I think that it's gonna help me just know how to better help myself. When you get into the aspect of like diagnosis and then treatment, it's kind of like, okay, what do I do now? So we've talked about like you can go to your primary care physician and you can say, hey, I like, what can I do to get assessed for this? Or hey, like I think I'm struggling with this, right? Lurk of time, got to get back to my math homework, of course. Enjoy. I was gonna say enjoy your homework, but you know, just do good, get it done. You got this.
Real.
um, so once you get to that point, you can go to your primary care. I won't. You can go to your primary care physician. Depending on your insurance, and I am going to talk a little bit about insurance because I've got a lot of experience in my field with insurance, and I know sometimes insurance sucks, but I do want to talk about this a little bit just so you kind of know about what your mental health benefits could look like. But whenever you're looking at insurance, if you have an HMO, you have to get a referral. So even if you want to see a therapist or you want to see a psychiatrist, like you're going to have to get a referral for that from your primary care physician. As to where if you don't, you're like PPO or whatever the other acronyms are, you can just go. You can find someone and go to them immediately. So that's why it's important to know that about your insurance. And the other thing that I make sure that I want you guys to know to ask the right questions when you're looking at insurance is like, you want to know what your mental health benefits are, because I know we've talked about like society as a whole, we're more accepting of mental health. So a lot of plans do have mental health benefits, but you need to be very sure that your plan that you're getting has mental health benefits. Because there are some plans that will cover it at 100%. My plan covers it at 100%. I don't have to pay even a copay when I go about my mental health. I do have to pay copays on my medicine, but therapy, my psychiatrist visits, I don't pay copay for that. So that's a really important thing I want you guys to look at. Like, what are my mental health benefits, right? And then the other important thing is like, if you do want to get treatment for certain diagnoses, you have to be diagnosed or your insurance will not pay for it or will not cover it. And so that's another important thing just to know about. I don't want to scare you guys about insurance, but just so you guys are educated on that type of stuff. So, hi, Dee Dee. um, so that's really important to know about your insurance. So from there, thanks for the group hydrate moon. So from there, you're like, okay, I need to get help. I've gone to my PCP. So once you get into therapy or once you get into, you know, psychiatrist, whatever it is, so there's different options for treatment that we just wanted you to be aware of. But again, you want to refer to your specialist that you're seeing about what type of treatment they recommend for you. But I know the biggest type of therapy is called talk therapy, right? You go to therapy and you talk to your therapist and you talk to them about what's going on in your life. You talk to them about issues and struggles you've had, right? Just talk therapy. I have experience with one specific type of talk therapy, but I do know of two specific types, but just knowing that there are many more than just those two. There's so many more, and I'm sure Moon can even like, yeah, there's a lot more out there, right?
Yeah.
Yeah. You go ahead.
I was gonna say like it's as far as like your like therapy goes, there are a lot of different ways to get treated. I mean obviously I don't want to go into like a full length discussion on like each of the types,
Mm-hmm.
but one thing I will say though is that it is very dependent on like your diagnosis, right? So like
Mm-hmm.
each diagnosis has their own kind of um uh say like treatment plan, treatment options, and they typically all go on a case by case basis. So like an example of this, I was looking at my I took a class in psychopathology last year. And part of that, like, I was like kind of just like pulling stuff from the notes from that I took from that class
Mhm.
as far as treatment goes. And one of the things that I found was people with OCD. They one of the treatment options for them is I think it's called like ERP. I want to say, and that is, let me, exposure and response prevention. So just like exposure therapy, right? Being
Mhm.
exposed to situations and a kind of conditioning your brain to not respond in the typical way that it would whenever somebody with OCD would like encounter that situation, right? So like or in um like I guess some examples of this, right? Like some examples of like people with OCD, they would probably like um, flicking a, you know, like an on and off switch multiple times, or something detrimental is going to happen to their family. Um, yeah, I think one like a way to I guess as far as exposure therapy goes, like being exposed to like say like a picture, right, or like a picture
Mhm.
of a family member, and then like a light switch right afterwards. Um, Turning that light switch off and kind of conditioning yourself to be like, my family is still fine, everything is fine. You know what I mean? And I think
Mhm.
we like to say this a lot too, like where we're like, I need to calm down. Everything
Mhm.
is fine.
I'm an adult.
I'm an adult.
Yeah.
We love that bit. But
Yes.
it's true.
Such a good
It's
one. And it
very
is
like
true.
it's something that we like. It's just something that we need to remind ourselves sometimes of. Is like,
Mhm.
you know, just kind of like recentering yourself and being like, everything is fine. I just need to breathe. I'm an adult, and nothing is going to change that.
Mhm.
Like there's like everything is fine. You know what I mean? Like that is just like kind of like I do that a lot as well whenever I get heated. Um and I will sometimes get heated to the point where I'm just like, I just like close my eyes for a second and I'm just like, you know?
Mhm.
Like that's just like surefire way, like whenever I just whenever in any case at all where I'm just like, this is too much. You know what I mean? I'm just like, I just remind myself, I'm like, I'm an adult. Everything is fine.
Mhm.
This is just like, this is all just, this is a temporary thing. You're not going to continue. This is not going to be something that I'm going to feel 5 minutes from now. I'm going to laugh it off 5 minutes from now. You know what I mean? Like, uh,
Mhm.
just kind of like things like that. And like I said, it's very different for everybody, but um you know, that's just one you know, therapy option there for people with OCD. There's also different, you know, therapy options for people with like you know, social anxiety or
Mhm.
depression or things of that nature. And then we'll get into those later, but I just wanted to say like it's very like case by case dependent on the diagnosis.
Yeah, absolutely. And so, speaking on, like we were talking about anxiety, depression, like a big therapy that was used in my case was cognitive behavior therapy. And I know that that one is pretty, it can be pretty common. And I do know a lot of people that know what that is. But just for those that don't, it is just an evidence based form of psychotherapy that helps individuals like identify and change those unhelpful thought patterns. I think that's the biggest part of this one. Beliefs and behaviors to improve like mood, emotions, actions. And so it's, I like to think of it, it's almost like trying to rewire your brain. So it's like
Yeah, very that.
yeah, you're trying to like um think about a specific situation. I think it's going to start with you like trying to like analyze like, okay, whenever this was happening, how are you feeling? I was feeling this. Okay, can you identify like why you were feeling that way? Like what about the situation made you feel that way? You know, this. And then it's like from there they can help you go back to, okay, how about when this happens now we do this, you know? I wanted to talk about what that looked like for me personally because I feel that CBT actually does work really well for me, which is not always the case for everybody, and that's totally fine because there's different therapies out there. But for me in particular, it had to do with like changing the way you thought or looked at something. And so I know I used to talk about how I would get really hurt or disappointed in certain instances, right? And my therapist would be like, "Well, this person that it happened with, like, is that something that would typically happen with them?" And I'm like, "Yeah." And I'm like, "Okay, what typically happens in that situation?" And it's like, "Oh, XYZ." And he said like, oh, well, just see that for what it is. Like, you know that that's going to happen. It's very common just based on previous occurrences of this, that this is going to happen. So just be prepared for that to happen. Like, don't think that it's not going to happen, you know? And I'm like, oh, okay. And so it's literally just, it was like talking through and thinking and like changing my thinking or my perspective on that specific to that situation. But it's pretty much what it is. You're just trying to like view things or look at things a different way so that you can kind of better control that, not even control, but you can better respond to that situation or your feelings or the way things might come up in those situations. That's been my experience with CBT. um, there's also, I know another one that I'm familiar with but haven't done is DBT, and that's dialectical behavior therapy, and that's another evidence-based therapy that deals a lot with like the acceptance of certain things, changing certain things, or more like learning how to like regulate kind of certain things. Um, and so this is specifically used to treat like emotional dysregulation, impulsivity, and other things like that. I think I saw too. It's used in treatment of like borderline personality disorder. And so different treatments for different diagnoses because our brains work in different ways depending sometimes on our diagnoses. And so I think that that was a really important point that you Moon had brought up too. That it's important to know like you know what diagnosis we have and like what struggles we have to know exactly what type of treatment is gonna help us. And I
Mhm.
know that something that you had even shared with me that I had seen is that um, there are certain types of disorders that may not currently have a set type of like therapy treatment, and so medication is still considered like the best option. And I didn't know if you wanted to speak on that a little bit, as far as like how you might have some that you might need medication, or you might have some where they're more interwoven together, just depending on diagnosis.
Yeah. So, one thing that we very much talked on in my psychopathology class that I had taken last year was, as far as treatment goes, especially for any sort of like any neurodivergency or anything of that nature, is we always try to like medication is like the quote unquote last resort, if that makes sense.
Mm-hmm.
Like we want to try as many methods of therapy as possible that don't require pharmacological treatment, which is a fancy way of saying meds. um but we want to try as many therapies as possible that don't require medication before we decide that medicine is like probably going to be a better choice. And even then, whenever we decide that, we try to, excuse me, we try to incorporate that into the treatment that a person is already receiving for that doesn't require medication. So like medication in supplement to cognitive behavioral therapy or dialectical behavioral therapy, or like even the ERP that I mentioned earlier. Sort of like having that medication and the impacts that those medications have
Mm-hmm.
on the brain chemicals and all of the other things, like the nervous system responses and all of that,
Mm-hmm.
like having that be incorporated into the treatment. And um, having because I feel like the medication will help a person sort of, I guess, clear their mind a little bit.
Mm-hmm.
And when they have a clearer mind, they're going to be able to um s- uh like internalize the things that they learn in the therapy a lot better than um if they were to go without it.
Mm-hmm.
And this is, and what when I speak on this, I mainly mean for more like severe cases of
Mm-hmm.
of a person's diagnosis. um and like one example of this, and I feel like this is probably like outside of like our our range, I'd say, but like one thing that was brought up in my class was schizophrenia.
Mm-hmm.
Schizophrenia, there's not really like a surefire, I guess,
Mm-hmm.
cure for it. So like people typically the case, like the way to go for treating schizophrenia would be to go on medication. That's like the main thing.
Mm-hmm.
um there hasn't really been any sort of like any, I guess, popular uh treatment that doesn't require medication.
Mm-hmm.
Medication is typically used as a supplement for treating schizophrenia, and
Mm-hmm.
that is once again like a more extreme case, and this would apply to more extreme cases as well.
Mm-hmm.
But that it also it doesn't, I guess, it doesn't have to be super extreme, but it just kind of goes back to my prior point of like taking like, we typically assess on like a case by case basis, right? So it's
Mm-hmm.
like if a person experiences XYZ, and um they feel that the medication, or like that they feel that the therapy that doesn't have medication isn't helping them, then that's when the caretakers would try to, like, I guess, like, think about the idea of
Mm-hmm.
incorporating medicine into the mix of the therapies that they're getting.
Perfect. I think too, it's important, speaking on my experience with my psychiatrist, because just like we said, it's also really important to note that like if you're seeking out therapy, that means you're ready for therapy, you know? And so in my case, I was getting to a point where I feel like it was getting very severe. I was still able to like get up and go to work on most days. But again, when you think about on the weekend, I would stay in bed or I'd be in bed for 3 hours, like awake and just like I can't get up and I'd cry, like, for seemingly in my head, like no reason. And couldn't do a lot of these things. To me, it was very debilitating. And so I went to my psychiatrist and I was like, I would like to get on an antidepressant and I am not ready for therapy. And he was like, okay, yeah, let's do that. You know what I mean? And so even if like you're in school and you're learning like okay we want to try the therapy avenues just because um those are probably most beneficial in the long run and you're not having to deal with like having medication it potentially being out of stock changing dose you getting to where it doesn't work for your body anymore like there's so many things that can go with medication. It still could be very case by case, and it's really dependent on the people that you have on your treatment team to help you make a lot of those decisions and make those like treatment decisions too. And so I think that's important to know as to where like in my case in particular, I was like, I'm not doing therapy. I was just very adamant about that at the start.
Hmm.
And then over time, he'd be like, hey, like, I think you really should start therapy, And now I'm at a place where I'm like, yeah, let's do it. I'm in therapy. Um, and so another thing that brought to the forefront of my mind that I make sure to write down so I wouldn't forget is also talking about treatment in like the right environment and the right supportive environment for you and you being in a very like safe space to start therapy because therapy can be it can be intensive, it can be emotional. And so I didn't know if you kind of wanted to speak on that at all, as far as having like support and having a good environment that you're in and that kind of helping with treatment as
Yeah.
well.
So this actually kind of ties to something that I'm working on with my thesis. So um we're trying to find a good, like, I guess, way to tie in social support as like a
Mm-hmm.
quote unquote buffer effect for um the constructs that I'm trying to study. But um it's very important first and foremost to have a good social support system,
Mm-hmm.
um because it and we've seen it all around, and I think it's also just very common to know that having a good support system that affirms you and like validates you and accepts you for who you are, given all of the things that you struggle with. It's very it it decreases your stress, it lowers your demoralization, and it's just all of those things. And it's just it's crucial to like healing and recovery, especially in therapy, because in therapy you tend to get very vulnerable with not only yourself but also the person that who is administering this therapy to you. You tend to get vulnerable, and having that social support system like being there for you um when you need, like, when you need someone to be like, hey, it's okay, that like, I'm really proud of you for doing this, and like helping you sort of be able to I guess reconstruct, not reconstruct the boundary per se, but like you broke down the wall to be vulnerable in
Mm-hmm.
therapy. Um but being able to rebuild that wall not as a wall but as a door, you
Mm-hmm.
know?
Yeah.
And I think like being able to like open that door whenever need be and not having like detrimental like effects whenever you choose to open that door.
Mm-hmm.
That's what therapy and social support in combination uh work to do. I
Okay.
think that that's like my perspective of it.
Nice. Okay. I like that. I like the door, the wall with the door. I like that a
Yeah.
lot. Do you have like any like advice or even just like recommendation? Again, this is totally just based on our experience, but like for someone who may not be in a supportive environment or is like not in an environment where it's like, yeah, go to therapy and see how it helps you, but it's actually like being looked down upon or, you know, getting treatment is looked down upon.
Well, as someone who has lots of experience in that, um um I can only, I feel like, again, I can only say from my experience, and um part of that was a prior point that I brought up was
Mhm.
being resilient and kind of just like keeping like I just whenever in times of adversity and in times of struggle where I didn't feel like I was socially supported,
Mhm.
I I tended to uh like keep things to myself, but I would also continuously give myself the affirmations that I needed.
Mhm.
And like I would tell myself the things that I needed someone to tell me in hopes of uh like just being able to make it through
Mhm.
in those times of struggle. And while they did help for a short time, they can only like it's enough to it's enough to get you through, hopefully to a point where you're able to sort of get out of that like non-supportive environment and
Mhm.
insert yourself into an environment that does actively support you and recognizes you and validates you. Because those kinds of environments are um we call those, I think it's like um in like a in the theoretical framework that I'm working with for my master or for my thesis, we call that like routine self-verification, where like
Mhm.
a person is essentially in an environment where they don't constantly need to remind people of like what they want to be perceived as, what they want to,
Mhm. Mhm.
what they want others to see them as, because those people already see them as that. And so they're like constantly like reaffirmed that people do see them as this. And
Mm, okay.
people are like people are aware of the fact that that a person identifies as XYZ.
Okay.
Um
Okay.
so um you know as far as like um finding, or I guess like navigating being in a place where um social support might not be as like
Mhm.
strong. um it's this kind of sounds morbid, but like it gets worse, but it has to get worse in order to get better.
Yeah.
And I
Yeah.
know that
Yeah.
sounds
Yeah.
so cliche, but like it has to like I feel like a person, every person is different, obviously, and it gets to a point where you have to realize like within yourself that like change needs to happen, and you might not get that change in your current position. So that's when you start actually seeking like you start seeking the right things that you need for yourself.
Mhm.
And like once that, like for example, me earlier when I was talking about like that click that happened where I was like, I can't prove those people that doubted me, or those people that didn't affirm me for who I am, I can't prove those people right and change
Mhm.
myself to appease them.
Mhm. Mhm.
I have to continue this route of like staying true to myself and being who I am, because at the end of the day, people like me end up like some of them end up conforming, and some of them end up completely changing themselves and just completely like doing a 180 on um like who they are.
Mhm.
and they end up ditching who they are behind, and sometimes like joining the other side and doubt, like you could like returning that adversity to other people who are struggling.
Mhm. Mhm.
And it's kind of it's hard to see that, but it's also like it's really difficult to um navigate that sometimes, because it's like those people, those people sometimes might be like people who you thought were friends, you know what I mean? So it's
Yeah.
like finding you know navigating from that to like a new sort of support system, that is also very difficult.
Yes.
um because it sometimes feels as though you have to establish like a good trust very quickly.
Mhm.
um but know that, again, it's one of those things where it's like it has to get worse in order for it to get better. Because once you make that click and make that realization, then things will start, like honestly things will start immediately like looking up.
Yeah.
And that's one thing that that's one thing that I remember experiencing, is like when I just like a simple shift in my mentality from like 7th to 8th grade. I remember
Mhm.
I would like when I was walking the stage, quote unquote, like
Mhm.
graduating from 8th grade going into 9th grade, I would get cheers. Like it was so drastically different from what I was experiencing the 2 years prior.
Mhm.
Like being myself and being confident and being proud of who I am is like when people see that in other people, it starts to reflect on them too.
Yeah.
And that's when people start like actually being like, oh fuck yeah, like this bitch knows exactly who they are, you know what I mean?
Yes, I love it.
Like, and just kind of like just like again being confident and being unapologetic. And it might like, I guess it might be difficult to do that, because it also it might incorporate a sense of like, do I actually feel this way, you know what I mean?
Mhm.
Like it's very different whenever um whenever you feel like it's a facade versus when it's like real. And I think
Mm.
that one way of like I guess distincting that is there's a difference in being confident in who you are versus having an ego. And there's this is
Mhm.
very common as well. um this is kind of derailing from what we're actually talking about, but I think like, as again, this is like part of my experience, right? So it's
Yeah,
like
of course.
I was confident in who I was, and I was very
Mhm.
confident in like, I still am confident in who I am, what my identity is, no matter how many changes I go through in however like period of time.
Yeah.
um but the one thing about that is I stayed true to my morals, and I stayed true to what what I believed in. And that has helped been a guide for me
Mhm.
um for how like since I don't know, like since the beginning of high school all
Mhm.
throughout now too.
Yeah.
Like I still get messages from people like um for example, like I talk about this a little bit, but like I used to do high school acapella.
Mhm.
um but like the videos of me like performing and like doing the solos and all of that, like my previous directors will still like show those videos as like
Yeah.
a method of like inspiration,
I
you know
love
what I mean?
that.
And so it's
Yeah.
like my confidence and my exuding, like just like everything that I like display within myself, and like me being so sure of who I am and
Mhm.
reminding myself of that, has really helped and come a long way. And it shows to like be an inspiration for others as well. So sometimes you like you got to pick up the pieces yourself, but when you do and put them back together yourself, or start putting them back together yourself, it'll be really beautiful. Something really beautiful will come from that. And just
Nice.
keeping like keep reminding yourself of that
Mhm.
as you go through and experience whatever adversity you experience.
Fantastic. I love that. Okay. So, and talking on as well, like having to change things and getting into a supportive environment or getting into a better environment for treatment, I think if you're not in a very safe environment, you're not in a very supportive environment. That's also something that you can let your specialist know, or your psychiatrist, or your therapist. Like that's, I think that that's something important for them to know. Like if you are trying to do that and you're being met with animosity, it can make it hard to go through the things you need to go through for treatment. And so I think that that's something really important that you can also communicate, with your provider, with your specialist as well.
Yeah,
Um,
absolutely.
yeah, and even speaking on um, like communicating with your provider. So I know like when some people go to the doctor, or they're getting their checkup or whatever, they're like, oh, I don't know, do I want to tell my doctor this? Or should I tell my doctor this? And it's kind of the same in the medical setting. Like the more honest and open you can be about the information that they're asking you, the better for you in general, and to better inform treatment. Because I know for me in particular, I did have to talk to my psychiatrist about like my alcohol use, which I don't drink at all anymore. But that was something that I feel like I had used as like my treatment for things,
Mm-hmm.
when I was like in my early 20s and was in college, and then kind of perpetuated from there. And then in the abusive relationship as like an escape. And so I did have to talk to him about that, and I've now have like he really recommended that I stop drinking just so that my medication would be more effective and it would actually like help me in the ways I wanted it to help me. And so like I don't drink anymore. And like yeah, sometimes I'm like, oh man, I just like want to go out with friends and maybe have a margarita, or like it's very rare that I wish that anymore. But even just something like that, like knowing the things that maybe you use outside of therapy. So if you do like to drink, or you do like to partake in, weed and things like that, like just that might be important to know, especially like if you're going through medication management, in particular. And so just being willing to like talk about and answer the questions that they have for you too. I just like that came to the forefront of my mind, just to
Mm-hmm.
like better inform treatment, in that way.
Absolutely.
Yeah. All right. So I think that we pretty much touched on everything treatment wise, but the other thing that I did want to mention kind of before we start talking about some of the resources that we have and some other maybe avenues people can go through for treatment, in particular, is when we talk about finding a provider, right? Um, So, like I said, you might have to go to your PCP and you might have to get a recommendation for like a therapist or a referral for a therapist. But I think it's still important to know like who you're going to see, in what ways they are certified, in what ways they are knowledgeable in what you might be struggling with if you already know. Um, because that's just going to help your treatment as well. So if you're not sure, go to a therapist and see and learn from them what you might need to learn about yourself, learn from them what their experiences are. For me in particular, like I knew from the get-go that my psychiatrist dealt with like depression, anxiety and things like that because I already knew that I had those things, right? And now, like when I was going to pick a therapist, I was trying to pick a therapist that had dealt in PTSD and things like that because I knew that those were going to be big things for therapy. And so I think being educated on like the specialties of your provider can also be really important too. I don't know if you wanted to add anything to that.
Yeah, I mean, you kind of, I feel like that's, I would say it's self-explanatory, but like
Mm-hmm.
good to say anyways, right?
Mm-hmm. Yeah.
But choosing someone who like specializes in the thing that you are seeking treatment for, um it is super important because
Mm-hmm.
those people who specialize in those things are going to be way more knowledgeable and um, way more efficient on helping you navigate those things and helping you to recover from those like whatever experiences that you're going through, um, because that's again that's their specialty, that's what they specialize in. So um, it's very important to find like that very specific person, but also like it's important to realize that um you're like the therapist that you first choose might not be
Mhm.
the very like the first person that you stick with for the entirety of the treatment for your specific like diagnosis.
Mhm.
um there might be lots of therapists that you go through because you don't like that one person does this, or you don't like that another person does this.
Mhm.
um and that's okay. A lot of people have had that experience as well, where they seek treatment from a therapist or they go to a psychiatrist, and they don't like the treatment that they receive.
Mhm.
So they'll try to switch around and try to go to a different person
Mhm.
to see if they catch a vibe from those other people.
Mhm.
And I think this is more so like on the therapist side of things. But yeah, like a specific like a particular therapist might not be your cup of tea. And one of the other things about getting therapy as well is that um you have to it's one of those things where it's like you have to catch on to and like kind of latch onto them very relatively quickly, because
Mhm.
you're going to be vulnerable and you're going to be talking about things that you know just kind of impact you as an individual on a deeper level.
Mhm.
um and if you're not feeling the person that you've latched onto, you're going to want to let go. And it's okay to let go, because there are many
Mhm.
other options out there who
Yeah.
might be better for you, who might have a more secure latch onto you,
Mhm.
and will allow you to be more vulnerable and make you feel okay about being vulnerable.
Mhm.
So
Absolutely.
yeah, that's pretty much what I was gonna say.
Perfect. Yeah, and I know for me, I had always seen male providers. Like for some reason, I always just like, and it's probably because of like my dad was really part of my life. Like I didn't have a great, male figure in my life. I mean my grandpa, but I don't see
You already set up the noise. There's already a video playing right here. It's
right.
okay. It's fine. Let's hydrate.
Let's hydrate though. Let's go for it. Hi Pog.
Thank you. I
Um,
hope your thing is going well.
yes. Eee! Okay. I love it. Supportive environments, guys. um, so I, for some reason, had always foreseen myself as like needing male providers because I was like, I just don't know how I would respond to a female provider, and that's gonna sound terrible and sexist. I just know that like that was how I was in treatment, and that there were probably reasons for it within my like past and my trauma potentially, and like that was fine, right? But I was like, you know what? I think this time around I just want to try like a therapist that I vibe with, and like see and not be so concerned about like that, And so I did end up picking a therapist that is female, and I researched into like she treats PTSD, she treats some of these more like bipolar, some of these other disorders, because I'm like, my psychiatrist had mentioned to me that we might need to look at like borderline personality disorder, just to be aware of. I probably like might not have it, but like I have maybe exhibited symptoms here and there. And so like I, knowing that, had been like, I need to look for someone that maybe has more experience in treating some of these other things. And so I picked her. And initially, it's actually funny because initially she said no to treating me, because on my problems list, I had listed like things that she was not specialized in. And so I
Mm.
called, and they were like, "Oh, let's get you another provider." And I was like, "Well, listen." I was like, "I researched my providers. I found this specific provider for this specific reason. Like, is there a reason like that I can't see them?" I was kind of upset. And then we re-looked at the problems list. I specifically said I really want to focus on like the PTSD and things like that. That I like that's what I want to focus on. And then they talked to the provider, and then she was like, "Oh yeah, she'll see you." You know what I mean? And so sometimes it's just like that. Like they want to make sure that they're properly equipped to help you, which is why it is sometimes important for you to even know like their background and things like that too. But yeah,
Hmm.
and then meeting her, I actually really like her. And I think that my therapy is going really well. Even though I was like worried about having a different type of provider than I'm used to, I was like, you know what? Let me just try, And I actually really
Yeah,
like
absolutely.
her. And then luckily for me, like my psychiatrist, I really like my psychiatrist too. And that was like my first psychiatrist I had gone to. But unfortunately, I do know some people that have said in their experience that they've had a psychiatrist that it just doesn't seem like they're really listening to them as far as like what they need, that they're just prescribing them medications based on like things that they're, that are out there now, not anything that they've worked specifically with in this specific disorder to treat, you know what I mean? And so I'm like, that's really
Right.
unfortunate. And that does happen. So it's like knowing the same way you would if you went to a doctor and they just didn't seem like they knew anything that was going on with you and it didn't seem like they cared, you would probably find another doctor. It's like the same thing. Um,
Absolutely.
and so just being, like we said, just being willing to like, okay, no, when you go in, you may not be with that therapist for the entirety of your treatment. It kind of is just going to depend on what you need and what you think is best for you as far as someone who's going to like listen to you, but is also going to do what's in your best interest as far as treatment goes. So I think that was important. Um,
Yeah.
I think we've pretty much covered everything. I didn't know if there was anything else that you wanted to speak on, whether it was like in your own experience or just like a general thing that you thought of while we were talking. Before we kind of go into like, I do have a resources section, but that's not going to be something that we're going to have to talk on like a whole lot. But I
Hmm.
think I pretty much covered
Um.
everything.
Yeah, I think you pretty much hit everything perfectly. Um,
You.
it's I guess the highlights TLDR or TLDS for too long didn't listen, or nope,
That's
TLDL.
an L.
Got it.
We got
Sorry.
there.
Anyway, we got there eventually. Um, but therapy is important, social support is important, but most of all, communication. Like that is like the number one thing, right? And being communicative with the person who you're getting treatment from, um, and being communicative with your social support systems probably as well to be able to get that information to likely relay to your therapist as well, like in the case that your social support system is showing you signs of like, I don't want you to be in therapy sort of thing,
Hmm.
then you
Hmm.
can relay that to your therapist. And then you know um not every therapist is going to be for you. um you know um your therapist's job is to link with you. Your job is not to link with your therapist. You're like
Hmm.
there to make themselves, I guess, good for you. You know what I mean? And if
Hmm.
they can't do that and they know they can't do that, then they'll set that boundary with you, like what Maureen was saying when she was saying that her provider denied uh her care because of XYZ, right? Like that's what you were
Hmm.
saying. It was with
Yeah.
um but yeah, that's it's just it's yeah. We hit the nail on the head with that. I think it's
Yeah.
good.
I think so too. I've really enjoyed this. I've really enjoyed doing this. And it just made me realize, like, because I think mental health is very important to both of us and we're very big advocates for it. Like
Absolutely.
just understanding it, getting help.
Hmm.
As we started talking about specific things like ADHD and about like depression and like how we grew up and like cultural factors, social factors, I was like, man, we could like have a whole other talk just about this or have a whole other talk just about this. Like there's so many different
Yeah.
things and topics. And so I like that this has kind of opened the door for some of that because I do want to do this more. So I just appreciate you saying that you would come on today and making time to do this while you're in a master's program working on your thesis.
If anything, this is just a rehash of all of the things that like I already know, and I think
Mm-hmm.
it's a rehash of the things that you already know as well. Given that you have your experience, you have so much experience in psychology as well.
Thank
So it's
you.
like you have like we both have very good, somewhat different perspectives
Mm-hmm.
given our experience, obviously,
Yeah,
but
I
um
would agree.
it's good to incorporate that into you know a space where we can have an open conversation,
Mm-hmm.
and it's good to talk about.
Absolutely. I love it. Couldn't have said it better myself.
What can I
S-
say?
so the resources that I have listed, if you think of anything else, like please feel free to say. But the first one I have is just the Suicide and Crisis Lifeline, and so they've recently changed it from a whole. I say recently, that also wasn't recent. They changed it from a whole like hotline number to just doing 988, which is awesome because it's short and
Oh
it's to the
wow.
point.
Okay.
And so that's awesome. And then where I found my providers, and I was actually just telling someone this today. Again, I have providers through them. They're not sponsoring this or anything like that. But like
This
they
talk is
do.
sponsored by the
I
person
know,
that Marie
right?
is talking about, actually.
No.
This is why we're
Um,
having this. No, I'm just kidding.
so I had someone recommend to me LifeStance. They're a big national, like really umbrella company that has like different providers in different states and different cities. And so to me, the process for getting a provider and getting in quickly to see a psychiatrist, a therapist, it just has worked really well for me. And I've been able to do a lot of it online, especially like if you're a new patient, you can do it online because I have trouble calling people. You
Yeah.
know, and so that was really helpful for me, and it was great. And I do telehealth, and so I've always just wanted to make a recommendation. Like LifeStance is a good resource for like just trying to find providers, even, um and just going through them. Like I just have enjoyed that a lot. And then
Brilliant.
the only other resource that I had in particular was just because it's worked so well for me and my ADHD, but it is like a bullet journal, which I think I've told you about before.
Yes.
Yeah.
Yeah, yeah, yeah. I remember.
So I
Mm-hmm.
had that recommended to me by a friend, someone in our new support group, our new supportive
Mm-hmm.
support
Our
system. I
new
say support
supportive
group.
environment.
Our new
Yes,
supportive
our new support
environment.
system.
Yes.
Mm-hmm.
Recommend to me. They're like, this didn't work for me, but maybe try this for you. And I think it's worked really well for me. It's like helping
Yeah.
me actually get like on a routine because I realized I never developed a routine that worked for me going from like high school to college into adulthood. Like I just didn't develop a set routine, and that's not good to do when you have ADHD because then things can get wild and crazy, right?
Yeah,
So
absolutely.
having routine and having like let me do things this way so it gets easier because I know with ADHD sometimes it's hard to do those really difficult things. Um, has just made that so much easier for me. So, bullet journal, you can like look it up on YouTube. It's just a journal that kind of helps you with like doing a day task. It has like a monthly task list, and then it has like an outlook for like 6 months with like things that are coming up. And so you can put all that. There's a space for all of that. There's a space for notes, and it's organized to where you can actually find all your notes because it has an index. And so I just really like that. Um, you can order a bullet journal specific, but I just use this. It's just a blank journal that I had, and because there's a video out there that shows you how to organize one. Um, and so I thought that was really awesome, and it's been a great resource for me. And I use it. I say every day. I've had some days where I haven't used it, but I use it pretty much every day. Um, so that was a resource that I had for ADHD. But I think that's it for me as far as resources. I didn't know if you had any other.
Honestly, I didn't I couldn't think of anything like going into this topic, but
Okay.
I was thinking the if you're struggling like financially, there's definitely there's charities out there that you can reach out to, and they will likely be more than happy to try to help you.
Yeah.
Like one prime example of this is to bring back what we did in June for the Trans Empowerment Project. Um,
Mm-hmm.
I know they are they're an organization to help trans people who are in areas of struggle or in times of struggle in their life.
Yeah.
And then there's you know there's I'm blanking on all of the all of the different types of charities, but there's there are resources that are working likely locally as well to try to help communities who are in times of struggle, and
Mm-hmm.
especially those of the those who might experience like stigma or whatever the case is.
Mm-hmm.
So, you know, just doing a search on like what is being uh like what is your, you know, like local community doing
Mm-hmm.
as far as like your kind of condition, or as far as your specific like thing that you want assistance for.
Mm-hmm.
That is one thing that I would say. um with as far as like managing ADHD though,
Mm-hmm.
I you put me on this for one.
Yes.
Spirit City,
Oh yes.
that's like
That's
that
a
is like
big
the
one.
yes, it's so huge and so helpful
Mm-hmm.
for like whenever I have like tasks that I need to get done and I feel like I can't put my mind to work on it.
Yes.
It's helped me establish that like using a Pomodoro timer is so helpful for me.
Yes.
It also has like tools to this is sponsored by Spirit City, actually, fun fact.
I wish.
I feel like
Uh,
I'm gassing it up so much, like, oh my
no, I'm the
goodness.
same way. It's got the task list. It's got the habit
Yes, it
tracker,
has. Mm-hmm.
journaling.
Mm-hmm.
It
It
has it
has.
all.
Yeah, and you also have like, you know, it's so customizable that like to give you like the prime environment that you need to get work done. And I honestly I can't go a day without like using it
I
if
get
I'm ever
excited to
working. I
use it. Like, I think that too, that motivation of like, oh, I'm gonna open this up and look at it. Because
yeah.
it's you can get it on Steam and it's almost like it's a game because it's got this whole like fantasy world in it, but it's like decorating basically. And it's like
Mm-hmm.
unlocking spirit buddies, you know, that's all it is. But it's like very, like you said, it's customizable, it's like fun to use, it's exciting to check out. They have two
Mm-hmm.
DLCs, one of which just came out this month, and it's amazing. Yes, I
But it
live by
also
this app, this game.
I think part of that is like it rewards you, right? Like it
Mm-hmm.
for getting your stuff done and for doing the things that you want to put your mind to. It rewards you with those like accomplishments of like getting the spirit buddies and all of those things. So like in a way it's
Yeah.
like a reinforcement, right? Of
Yes,
like
absolutely.
getting those you know, getting your task done. Congratulations, you now have this, whatever. You know what I mean? Like
Yeah, and
you
it
get
gives
rewarded for it.
you like as you do things daily, and like your XP is like this currency that you can use to get decorations. So yeah, exactly. It's
Mhm.
totally yeah, it's really cool.
Yeah.
Like yes, I think
Um
that's a great resource. So it is
so that's yeah,
Spirit City
definitely that
Lo-Fi
for sure.
Sessions is the name of the full name of the game.
Yes,
Yeah.
Spirit City Lo-Fi Sessions. That's one thing that I have brought to you by Spirit City Lo-Fi Sessions. Exactly.
Right? I
Boots.
wish. Hi Jedi.
um but yeah, that one for one is a very good source, I'd say.
Mhm.
Um I've incorporated like uh sort of like daily check-ins with my friends, or like with my close
Yeah.
others, like my social support system. I've tried to do like a daily, just like, hey, like, you know, checking in, how are you doing,
Mhm.
like what's the vibe, all
Yeah.
those things. um but you know, it's going into this semester, I'm a lot busier because I have to essentially write a proposal for my thesis. So I'm just like, I am so like locked in on all of the things that I need to do. But
Absolutely.
one thing that I've recently done is write like affirmations for myself. And
Mhm.
I know you do this as well,
Yeah.
but I bought a little board that literally just has all of my, like, it has like the day, and then it might, I don't know if it shows up good for you,
Yeah.
but
Yeah.
it
Yeah.
has
Yeah.
like the day, and then it has all of the like my affirmation for today. And then I have on here as well like my tasks that I need to do. I have a priority task that I it's not being set. Okay, there we go. Sorry, I was trying to put it back without it falling. But so I have like a priority task that I focus all of my attention on, and then once
Mhm.
that's done, then I can look at my other like things in a task list, and then I also have like a time tasks list where like those tasks that take a lot more time.
Yeah.
Those are things that I like need to set chunks of time aside for in the week,
Mhm.
or possibly reschedule because they're not as important, if that makes sense.
I love
Um,
that. Okay, that's yes.
so that has definitely helped me to be a lot more organized and
Mhm.
be a lot more just like cognizant of like what's going on in my life, and allow me to like sort of regain control.
Mhm.
So I wish I had my phone on me, because I have like I have like a reminders list on my phone as well, and I have just like little things that I've incorporated over time to help manage the ADHD. You know what I mean? Like
Yeah, and I think
because it feels so disorganized. But please,
yes.
yeah,
I think the
yeah.
big thing too is like finding what works best for you because I've tried apps and for some reason, I guess it's like, I'm in my 30s. I guess it's like the way I grew up to where like technology came more as I got older. So I did do like pen and paper, like, and so some things I like the technology aspect and some things I need pen and paper. And I think it's just like knowing that, like,
Hmm.
so if I have apps, I'm less likely to use them every day, daily for what I need. As where if I have
Hmm.
things like the journal, you can have probably a digital journal that's the same thing. I have to have one that I can write in physically because like that's how I roll. So like
That's so
it's
fair.
knowing
Yeah.
what works for you, I think is really important too. But being able
Hmm.
to manage it in all these different ways too. So I think that's
Hmm.
like, yeah, I've really enjoyed like the fact that I have Spirit City, I can just whoop, and it is electronic, awesome. But I have to have things I can write,
Hmm.
and then I have to have like I like to try to keep things in one space. And so like if I try to organize, but then I have this document, this document, and this document, it's too much. So I try to keep as much
Yeah.
like in Discord as I can. And so even like that friend who suggested like, hey, why don't you have like a planning Discord? I have a planning Discord, and I'm like, oh my god, that's amazing. So then I can keep everything
Speaking of
there.
discords,
Oh, hey,
I
speaking of
just put one of our
Discords,
discords right
I
there.
love it. I love it. Yeah, if you guys liked the talk today or you're interested in hearing more talks in the future, or you think that we're just two really cool people, you know, confidence,
Ideally, that's
self-confidence,
the
not.
exactly self
um
confidence.
these are our discords, our servers you guys can join. We both keep them updated with all the events we have coming up on stream, and any other like cool resources we can put there as well, usually. And so yeah, thanks
I
for
was gonna add
that.
on to the yeah, I was gonna add on the as far as like the journaling stuff goes, um like you said that you typically write down like whatever you got going on with
Mm-hmm.
like using like pen and paper. I have an app that it's called Stoic, I think is what it's called.
Mm-hmm.
That's what I use to get my daily affirmations, but I also
Mm-hmm.
use that to sort of check in with myself too, like at the beginning of the day,
Nice.
or just like at any time at all where I'm feeling like I need to like write something down and I
Mm,
can't like voice it, you know what I mean? If I feel
yeah.
like I'm in a space where I'm not able to voice the things that I'm feeling, then like I this is like a, one again, this is a very recent development, and I've
Mm-hmm.
done probably a few of these. Um and this was um when I started doing this was at a time where I was in like a heightened sort of emotional state, I
It's
think.
fine,
Like that's
Jedi.
kind of like where I was.
Sorry, I was laughing at
What's up?
Jedi. I was laughing at what
No, you're
Jedi
good.
said.
Oh, love that.
Go ahead.
Um I was gonna say, like I typically like to use, or I started using the journaling app to just kind of jot down like my feelings, what's going on in the like
Yeah.
in the day, or like some events that are happening soon. And I've noticed that in the few times that I've started writing stuff is when I'm in like periods of like high stress, or periods where I feel really dysregulated, or things of that nature. um and so it's really good to just kind of like go ham on this, but it's also like if you feel like um typing out might not be the best for you, then it's absolutely okay to like do like pen and paper as well.
Oh yeah.
Both methods are like super valid. It really, again, like Maureen was saying, it's just very dependent on what works for you, and finding that
Yeah.
is what's good.
The funny thing is when I journal, when I actually journal, because like to me the bullet journal is more like to-do lists almost. But when I journal,
Okay.
like actual journal, check in, you can put like notes in there. And so if it's just like a note I need to jot down really
Yeah.
quickly, I do that. But the funny thing is when I'm actually journaling about my feelings, I usually like to use Spirit City's journal because I can type,
Ooh,
because my
okay.
thoughts move so
Mm-hmm.
quickly and I can type pretty quick. But
Yes,
there are a couple in there
absolutely.
when I was just jotting a note for the day because I was like, oh, it's organized that I have it in here by day is like the stuff I needed for therapy, which is like tracking my mood. Today I was feeling
Mm-hmm.
this. Today I was feeling this. This happened. Like just quick stuff. I'll put in there. I'm weird about journaling. Writing is too slow and typing is too fast.
What if you
You,
did voice to
I was
text?
gonna say voice to text or learn shorthand.
Wait, T.
Yep.
Shorthand. Okay, I you know what this reminds me of? There's I have a feeling you know where I'm gonna go with this, but
What's
there's a
up?
Nancy Drew game that I used to play. There's a Nancy Drew game that I used to play. And one of the things that I had to learn was shorthand to learn what the name of a carousel horse was. And I was like, I just took like a short like crash course through the game on like certain things that I needed to learn for shorthand, and I was like, this is so funny. Like you said shorthand, and I
Honestly,
immediately thought of like that one scene where I was like, the name of this carousel horse, where Nancy was like finding out what the name was, and I was like,
that's
this is tea.
so funny. I
Period.
love it. Then I forget shorthand and think it's a prescription from my doctor. That's
Real.
so funny.
Well, you should
So
have. You know what though? I think have a journal, and then when you write the title of that journal, write it in shorthand, and then decorate it to make it all cutesy, so you can be like, this is my journal for my feelings, and not a prescription book from
this
my
is my
doctor.
journal about my feelings. I love that.
This is my journal for my feelings. I want to try. Okay, real quick. I'm gonna try to find my phone. I want you to continue talking, but I'm gonna try to find my phone because I really want to show this app because I
Yeah.
think I like this the Stoic app that I'm
Yeah,
talking about.
absolutely. Go look
I'm
for
gonna
it.
try and
Go
find it.
go
Give
get
me
it.
a second.
ADHD problems. We don't know where we put
Yes,
things.
literally. I am gonna turn my camera off though because I'm probably gonna have to get up. So give me
No, you're
just a
fine.
moment.
You're fine.
Where is? Oh, it's right here.
As far as check in on
Uh,
friends, oh my gosh, let me see this. Let me see this. Let me see this. Honestly, that's good. I like that. How you doing? Good. Okay, bye. Like, that's literally all it is. The funny thing is that's literally all it is. Because sometimes like someone asks you how you doing and it depends on the person. You'd be like, I'm good. You'd be like, I'm okay. Like, you give those answers. But if it's like someone in your support system and or how are you doing? I'm not good. Like you can actually say that. I'm not good. That's a good check in and it can lead to other stuff. Yeah. So as funny as that is, that can be all it takes. I love it. I think the only other thing I was gonna say. Oh, so if you're like me and you're just like weird about journaling in general, because I'm always like, I don't know what to write. I don't know. What should I do? Like, what should I write about? Spirit City also has like prompts, which I think helped me a lot when I was like starting to get back into journaling. So having a prompt, and it can be something like, what's something you want to achieve today? 3 pages every morning, train of thought. Just get all the
okay, I
just get
found
all the
it.
weird thoughts out. There you go. That's perfect. Your train of thought, literally just sitting there talking, like, and when you're saying things in your head, and you're like, well, whatever, just writing it all down, getting all the weird thoughts out is just really funny. I love that,
Mm-hmm.
but so
So
true
I
and
was
so
gonna
needed.
show right quick. So first and foremost, I have one of my what do you call it? One of
It was
my like
from
home screens.
this
I
book called
have
The
like my
Artist's Way.
reminders here.
I think I remember you talk. Sorry, I
Am I
think I
muted?
remember you talking about that. No, you're fine. I'm so sorry.
You're good.
I think
No,
I
you're
remember
fine. Sorry,
Jilly
I was
talking. No,
ADHD.
you're
Who's
fine.
gonna talk first?
No,
Who's gonna
so
talk first?
sorry. I did it for like a month. That's so cool. I remember you talking about this book. I'm reading this book called The Artist's Way, and I remember that. I like that you did that though. So the writing, having your train of thought, just writing it down in the morning, so you said getting all the weird thoughts
Mm-hmm.
out. That's cool. Okay, show me your
Mm-hmm.
app. I'm so sorry.
Okay, no, you're good. I was just gonna say this is one of my home screens first and foremost. So I have like my reminders here. You can barely see that.
I
Sorry.
can see
Okay.
it.
Reminders here. And then I have like the calendar here just to make sure that I'm, cognizant of what day it is. And then
Yep.
I also have like my one of my more important reminders that's coming up. Like right here. This is a new development because there's like a time crunch happening for something that I need to sign up for, but the sign up hasn't actually opened yet. So I'm like, okay, reminder that this is happening soon, like get make sure that you like are on top of this and making sure that you're checking in on that.
Yeah, I like
And then
that.
also this is the app. So when you walk in, or not when you walk in, but when you open the app, it's like do your check-in. But then you also have like inspirations right next to it, and then I have my inspiration today being in the success manifested category. So that's where my affirmation for today came in, where it
Mm-hmm.
says I
Mm-hmm.
celebrate my victories big and small.
Yeah.
um and then I also have like the history of like doing like reflections in the app as well. So like I have when I first started doing them, um was just like a little description like this, and then I would have like a description right next to it, and then it asks you questions like how are you feeling today, like do you sleep well, what are your focuses for today,
Mm-hmm.
and it gives you like keywords like work, relaxing, friends, cleaning, just all of those things.
Yeah, it could be something
And
simple.
then it allows you to do multiple check-ins per day. I have mine set to 4, and I was being optimistic with it. Like I said, I rarely do it. Like um, in the times that I've done it, it's been during times of like high stress.
Yeah.
So like the first like couple of times that I was doing it, it was around a time where I was like, it was around a time where I was like really really stressed about like something for my thesis project. Um and then the last time that I did it was this week actually. So there was something that happened earlier this week, and I was like, I really need to like voice this out, and I'm like really like I'm getting really stressed out about this, and I'm getting
Mm-hmm.
really like I feel like shit because of it.
Yeah.
But let me write this out rather than like containing it, because like feelings contained, obviously not good, as we've spoken on a lot this
Mm-hmm.
throughout this entire podcast.
Yeah.
But just finding the method that works for you as far as expressing how you feel, um again, is so super important.
It is
Yeah.
absolutely awesome. I was Jedi said that the book that Artist Way was written by Martin Scorsese's wife, and I was like, oh. But I'm laughing because too, whenever you're showing your phone, we're all just like enhance. We're like leaning forward.
Oh, sorry. Yeah. Well, I
No,
mean,
we
I'm
were
not going to
just
show my
laughing. Like that's.
reflections,
It's also
but
because like I can't always see anymore. I think I'm becoming
that's
nearsighted.
fair. So this is like the reflections there. You can even see that shit. Hold on one
No,
second.
I
Let
could
me
see
try
the
to.
way your thing was organized though, where it was like the thing. I can see my reflection in there.
Yeah. There you go.
So funny.
And then like
What's the name of the app though?
it'll
Did you say
this app is called Stoic.
Stoic? Okay,
Stoic. Here, I can put it
Stoic.
Stoic. Oh no, Stoic. Exactly like
Nice.
that. And the
Cool.
icon is an S with a period right afterward. So,
Period.
um, yeah, period.
Period.
Boots, Stoic boots.
Love
Um,
it. All right, cool.
but yeah,
Well, I think that's pretty much everything that we wanted to talk about today. So I don't have anything else to add. Thank
yay!
you again, Moon, for joining. And then I did
Thank
want
you
to
for having
do,
me.
of course, I did want to do more talks like this. And so we did a talk or we did a panel for Level Up for Pride in June. I'm doing this one now. As I just have more ideas and stuff, I want to do more talks like this, and so I'm excited. Yay! I'm glad we did this
Yeah,
one. Yay!
I'm also really glad we did this.
So I am going to be streaming again on Monday. I do co-working on Monday. I've already been talking to everybody, but I know I did 2 days this week where I did daytime streams. I'm probably going to be slowly transitioning into daytime stream slot. But yeah, like I said, Discord is where you'll find like my schedule for the week, and it'll have days listed that I'm going to be doing daytime. But I will be streaming again on Monday, and it will most likely be an 11 a.m. Central stream. For we're using Spirit City Lo-Fi sessions, doing co-working and stuff. So
Shout
when
out
are
to Spirit
you
City.
for real?
As far as of right now, I am planning to go live again tomorrow, and I will also be co-working.
Yes.
But I don't tend to use Spirit City on stream. I have like a separate timer for that. And I also have like the little like taskbot and stuff, and I think Marine also has this taskbot for co-working. But I will be co-working with, as of right now, I will be co-working with the Wenders. I typically I've started co-working with her on Sundays. We body double with each other, and body doubling is a very very good way of managing uh co-working, and I think that Marine
Yes.
like introduced me to body doubling, introduced me to a lot of things. Shout out to her.
Oh, hey,
Um,
here you. Just kidding. Yeah, body
but
doubling is
yeah,
just having it's just having someone in the room with you or in a voice call with you. They don't even have to
mhm,
be doing the same thing as you. They don't like it's just body doubling. It's like works so
yes.
well for ADHD as well. So
hmm So yeah, I'll be doing that tomorrow.
beautiful.
Um, and yeah, that's pretty much what I got going on tomorrow.
Okay, awesome. Thank you guys so much. I hope you guys have a great night. Thank you again, Moon. Love you.
I love
Um,
you. Thank you so much for having me.
yeah, and we'll see you next time. Bye.
Bye bye.